Are you tired of looking in the mirror and being unhappy with the reflection staring back at you? As the face ages, several things happen. We develop wrinkles, our skin loosens and sags, our brows start to droop. These symptoms can make you feel much older than you actually are. The McLean Clinic offers a wide range of procedures that will help you combat the aging process. Dr. Hugh McLean is here to show you how you can recapture your youthful appearance. This is Daily Web TV. To be young again, or at least look like it. Well, there is no fountain of youth, but there is Dr. Hugh McLean. Now, Dr. McLean, tell me, first of all, let's find out who comes to you for facial rejuvenation. What is the candidate for this type of work?
Well, Sheila, cosmetic surgery is surgery for normal people to make them look better. And so it's really normal people that come to me. It's people like you and me.
So I imagine aging may be a factor?
Well, certainly for facial rejuvenation, you need to be probably a minimum age, but sometimes people, even in their 30s, are ready to start what we call a maintenance lift to always look good.
Wow. Is there any benefit to starting younger?
Well, I think for some people there is. If they're starting to get jowls and they just want to maintain a good look, I think some of the movie stars actually do that. And if you leave it too long, then you're really trying to restore a look rather than maintain it.
So you're well known for your famous 3-day facelift. Tell us about it and what are the benefits of it?
Okay, the 3-day facelift was actually invented by Dr. Harold Silver, who's now retired, and I'm carrying on his tradition. The benefit of the 3-day facelift is a quicker recovery. What we do in the 3-day lift is to use techniques that minimize bruising and allow people to be out in public without drawing attention to themselves, often within that 3-day period.
Wow. So what would a typical procedure take? A week or two before the bruising is minimized enough?
Mostly I tell people they would need 2 weeks.
Really? Well, that sounds very exciting. Everybody would want to get out sooner if they could, obviously.
Absolutely.
And what other types of techniques can you do to the face to create a youthful appearance?
Well, you know, we think of a facelift as lifting this part, the jowls and the neck. There's also brow lifts to reposition the brows, especially when there's a lot of hanging skin in this area. And then the eyelids are another big feature because the eyes are the center of the face.
Right, right. Certainly they draw the most attention when you look at someone. So you can do an eyebrow and an eye lift.
That's right.
And who else comes to you for facial plastic surgery? Is it all cosmetic, or do you do any other types of procedures?
Well, I don't do any real reconstructive surgery, but you know, there's not only facial aging, there's also the features that people have, the nose, the chin, the lips, the ears, and there are things we can do to improve those things as well. And that's not an age-related thing, it's a thing that depends on a person's self-image.
Right. So now you say the ears. What can you do for the ears? What types of issues?
Well, you know, we call the ears that protrude outstanding ears, and we can certainly pin those back to make them look better.
Really?
Yeah, that's something that's often done in children.
So you can do that very young, and they'll keep that position as you grow older.
Absolutely, yes.
Interesting. Now, what else can you do to complement the work that you do once you've had the plastic surgery and you're done with your procedures? Is there anything you can do to add to it?
I always tell my patients that we can help appearance in terms of, say, skin sagging or skin or volume depletion, but we can't help the surface of the skin with a facelift. Good skincare will do that. Microdermabrasions, chemical peels and that kind of thing, laser treatments are available at my clinic for that, as well as the injections such as Botox and fillers to help people with their lines and wrinkles.
So you actually would benefit by having injectables even though you've had a facelift?
These are complementary things. You know, you can have those things before a facelift, and you may even want to have them after a facelift.
That's great information, Dr. McLean. If someone wants further information, where can they go?
They can go to my website, mcleanclinic.com or facelift.ca.
Facelift.ca, how appropriate. Well, there you have it. You too can have that movie star youthfulness. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.